remember your ID. All right. Now that I reminded you of all the important things you need to know, are you ladies ready to kickstart the session? Because I am about to tell you what we have in store. Okay. So on Mama Talk today, we talk about breast. Saggy breast is a common bodily phenomenon that we will experience all throughout our lifetime as women. Okay. As we grow, our breasts go through many changes as well, okay? Throughout pregnancy, breastfeeding, fluctuating weight gain and weight loss. But what actually is the cause of saggy breasts? And can we prevent it? I think that's like a magic question. I've been wanting to know that as well. Now, in this intimate webinar brought to you by Mama Is'Belle Indiba, we have lined up experts to help introduce you to the changes of our breasts throughout our life. So explore the causes of sagging breast and how to retain its perkiness, learn what is mastitis, hyperplasia, and gain the how-tos of regular breast self-examination that can save our life. So it's all about our breasts today. We have so much to learn, to discover, and to uncover as well. And don't forget, if you have questions, remember to type it in the chat box below. And as we mentioned earlier, ladies, this content for this evening's show is designed for adults and females only. The presentation slides throughout the show may contain content of adult nature and is not suitable for anyone under the age of 18. So therefore, viewer discretion is highly advised. So let's get to our speakers today. On our lineup, we have Ms. Gan Ai Singh. She's a physiotherapist with over 9 years of experience in both hospital and clinic settings and is qualified with a Bachelor of Physiotherapy Honours and is registered with the Malaysian Physiotherapy Association, MPA, with close to 10 years of clinical experience. She is experienced in diagnosing and strategizing effective treatment plans for her patients. Now, she's highly professional and is committed to providing her patients with the best care possible. Our second speaker is Ms. Lee Peng. She has more than 20 years of experience in the beauty industry and is the managing director and founder of Is'Belle for more than 18 years now. Now, she saw the importance of breast care in the early stage of her career and has since been focused on providing the most suitable, significant, and effective beauty advice for all of her clients. Amazing speakers, don't you agree? So if you're all ready, let's kick off the show today by giving Miss Gan Ai Singh a warm welcome.
Hello, everyone. Good evening. Thank you, Meg. Let me share my screen.
How are you today?
I'm good. It has been a rainy day.
Indeed, it has.
Can you see my screen?
Yes, we can.
Okay, let's start. So thank you, Mama Net, for having me here today. I'm Ai Singh. So today we'll be talking about our breasts. Okay, so breasts are part of women and men's sexual anatomy. However, for women, right, breasts are actually both functional, where it produces milk for breastfeeding, and also sexual, where it provides pleasure. As for men, their breasts do not have any function. Yeah, just purely for pleasure. Okay, so moving on, before we begin, here are some topics that we'll be covering today. So first, the basic structure of breasts, what are breasts made of, and the different breast shape and the changes that our breasts undergo during and after pregnancy. So we will also touch on the color changes in our nipple and areola, and the common conditions that women face, such as mastitis and breast hyperplasia, and also how to take care of our breast health and also the current breast care treatment that we have in the market.
Very interesting content that you have lined up for us.
Yeah, so I hope you guys have a great takeaway at the end of this session.
I hope so too. Remember, if you have questions, type it in the chat box below. Okay, so I think the stage is all yours.
Thank you. So now we'll move on to just the basic structure of breast. So our breast is actually a very complex structure. It contains blood vessels, lymph nodes, nerves, fibrous connective tissues, and also ligaments to support our breast in place. So our breast is mainly made out of adipose tissue, which we know as the fat tissues, and also glandular tissue, such as lobules and also milk ducts. Okay, so lobules is actually where the breast milk is being produced, while the milk ducts is what the ducts that carry the milk to our nipple. Okay, and these two tissue, our adipose tissue and also our glandular tissue, is actually the one that determines the size of our breast. Okay.
I did not know that. That's very interesting.
Yes. So breast changes during and after pregnancy. So before we understand about the changes, first of all, we must know there is different shape of breast. Okay, so there are various shapes, types, and also size of breast. So, and one thing, Meg, did you know that different race and ethnicity actually give you a different shape and size of breast?
Really, I didn't. I really did not know that.
Yes, because genetics plays one of the biggest role in the size
Okay.
and the shape of our breast. So actually, our breast characteristic can come from both sides of our family.
Okay.
So our dad's gene also can affect how our breast end up looking like.
Oh,
Okay.
wow. That's
Yes.
so interesting. I did not know that.
So based on these diagrams here, you can see there's actually 7 different shapes of common shape of breast. So first of all, we have round, where we have equally full at top and bottom. Okay. Then we have asymmetrical, where one breast is bigger than the other. And then we have side set, where there is a big space, a white space in between our breasts.
Okay.
And bell shape, top is slim and bottom is full. And for athletic is a smaller and flatter kind of breast.
Okay.
And east-west, as the name call it, our nipple actually face outwards.
Okay.
Yeah, and for the last one, teardrop, the breast is actually less full on the top.
Okay.
Okay, so these are the 7 different shapes of breast that we have.
Okay. It's very interesting.
Yeah. So changes during pregnancy breast changes can be expected during and after pregnancy, whether or not we breastfeed. Okay. And then the changes of breast and nipples can happen very early in pregnancy, even before you know that you are pregnant.
How early are we talking about?
At the very beginning of the pregnancy, even before you miss your menstruation, you might already have the symptoms actually.
So our breasts would know that we're pregnant before we actually know we're pregnant.
Yes.
Okay.
So usually the early signs that you experience very early on is sore breast. Sometimes we do experience this before menstruation as well.
Correct.
Yeah. So another thing that you might notice is your nipples getting darker and larger. And then next thing you know, your breast is growing in size, your bra no longer fits you. And also at the end of the 3rd trimester, you might experience some leaking. So all these changes are actually due to hormonal changes and also the increased blood flow to the breast area to prepare our breast for breastfeeding.
Okay.
Okay. So one of the most significant changes to breast after pregnancy is actually breastosis. So this is saggy breast.
Breastosis. Okay.
Yes. So breastosis is just the medical term for sagging of the breast.
Okay.
So you can see in this diagram here, there's actually 3 grades of breastosis. Okay. So how we actually measure this is actually we measure from the nipple to the crease at the bottom of our breast here. Okay. So if the nipple is above the crease, it's normal. Okay. So if we have grade 1 ptosis, which is a mild ptosis, okay, so you have your nipple 1 cm below the crease. Okay. So in moderate ptosis, grade 2, your nipple will be in 1 to 3 centimeters below the crease. Yeah. And in severe breastosis, you have more than 3 centimeters. So your nipple will be more than 3 centimeters below the breast. Below the crease, sorry. Yeah. So one of the way that you can check at home is a very simple way. We all have a pencil at home, right? So you just put the pencil horizontally at the crease at the bottom of your breast and then see the position of the nipple to the pencil. So if anything above your nipple is above the pencil, you do not have any sagginess. Breast sagginess. Okay.
So today we have homework to do, ladies, when we go back. Or rather, when you're done with this seminar, you can do that.
Yeah, just take a pen or any kind of stick that is straight. Okay. So moving on, what causes sagging of breast? So it is important to know that we will actually naturally experience some sagging as our breast changes over time. Okay, but what are the main cause of sagging breast is first, aging.
Okay.
So as we grow older, you can see in this picture here, we have these ligaments called the corpus ligaments.
Mhm.
So it's actually the ligament that support our glandular tissue. So to
Okay.
keep our breast in place. So as we grow older, you know, our body will experience some kind of deterioration. So these ligaments will also go through wear and tear, and then it will be stretched and lose the elasticity. So that's why our breasts sag down. Okay. Secondly, lack of proper support, especially during sports, during workout. Okay. We must always wear suitable, comfortable bra to work out. Okay. If the bra doesn't fit well, there is no stability for your breast, and then it will increase the wear and tear of this ligament. So we wouldn't want that.
Definitely.
So thirdly, smoking. So as we all know, cigarette smoke contains carcinogen. So it will actually break down the elastin in our body. So it will actually cause our skin to lose elasticity. So our breast will actually appear more saggy because there's no support from the skin. That's one of it. And also lastly, weight fluctuations. So
yeah, that kind of goes without saying, isn't it?
So with weight gain, you know, our breasts, you know, earlier on I mentioned our breasts actually contain adipose tissue, mainly adipose tissue. So when we gain weight, the adipose tissue will increase more fat to our breast, and then it will actually stretch and stress on the ligament as well. So as we lose weight, you will see your boobs go smaller and it start to sag down.
I think that's a common problem a lot of women face, isn't it? I hear every time they say, hey, you know what? I'm trying to lose weight, but I'm losing my breast instead.
Yes, that's what happened. So it's very important to have a healthy weight. Okay. So next, moving on. I have a question for you, Meg. What do you think? Does breastfeeding cause our breast to sag?
I don't think so.
Yes, that's correct. Actually,
yay!
No, our breastfeeding doesn't cause the breast to sag. This is just a preconceived notion that most of us have, because we must understand that the size changes is actually the cause that our breasts undergo. The size changes throughout the pregnancy. This is the cause of breast sagging, so not breastfeeding. Okay. So go ahead and breastfeed without any worries. Okay. So now we'll move on to the nipple and areola. So as we know, as I mentioned earlier as well, when we are undergoing pregnancy, you will actually notice that your nipple and areola gets larger and darker. So what are actually the cause of this? Okay, so it is actually mostly caused by our hormone, estrogen and progesterone. Okay, because our estrogen and progesterone actually have an effect on our cell, the skin pigmentation cell. Okay, so it will change colors. So I'm not sure, most of us might not notice this, but actually as we grow, when we reach puberty, our nipple actually gets darker. Our nipple and areola actually gets darker. And then right before like having our menstruation, we might experience the same thing. And of course, during pregnancy. So you can actually observe these changes. So
I think this is one change that I never observed ever. Now that you're actually mentioning it, I'm like, why did I ever notice it? So
because actually we don't usually go around looking.
Correct. I think it's because mainly because we're Asians and we're always like, it is a taboo topic, right? So we want to keep everything covered all the time. So we don't even look at it.
Shower and come out, that's it.
Correct.
Yes. So something to observe and notice.
Definitely.
Another thing is oral contraceptives. So this is a birth control pills. So birth control pills do affect the color because it contains mixes of estrogen and progesterone as well. Therefore, it may affect the nipple and areola colors, similar way to the hormonal changes. Okay. So, and during pregnancy, as I mentioned earlier, it's also because of estrogen and progesterone. It goes to our breast to help us produce milk.
Correct.
So, so that's why the color will change. And lastly, postpartum. This one, whether or not we choose to breastfeed, right? The areola and nipple will still be darker after we deliver. Okay. So this for our nipple and areola.
Yeah, so at least when you know, you won't be like shocked or worried, right? If you see a difference.
So most of the time after postpartum, after a while, then actually it will go back to normal. But in some cases, it does stay that way. Yeah.
Okay, but there's nothing wrong with it being that way.
It's nothing. There's nothing wrong with it. Yes, definitely.
Okay.
Okay. So now we move on to some common breast problem that we face, which is mastitis and breast hyperplasia. So mastitis is actually the inflammation of our breast tissue that sometimes may involve an infection. So as you can see here, it is red and it's swollen, slightly swollen. Yeah, so this is the inflammation of our breast tissue. So some symptoms that you might have because of the inflammation, you will have painful breast, your breast will be tender to touch, then you feel, when you touch it, you feel warmer comparing to the other side of your body, and then you'll see redness there. Some may also experience fever and chills, and it usually affects only one side of the breast, usually not the both sides.
Oh, how come though?
Because our breasts are independent. They come in pair, but it's independent, and this one might have an infection. So it's usually just one side. Usually it doesn't affect the
other one. Okay, which is a good thing, you
wouldn't want both
sides, correct.
And painful. Okay. So another question is, because mostly we see mastitis in breastfeeding mothers.
That's right.
So do you think that it can happen if you don't breastfeed?
I'm guessing yes.
Yes. The answer is yes. Yeah.
So how?
It can occur due to infection, same thing.
Yeah.
Or if you wear bra that is too tight, your breast cannot breathe well, then it might cause the inflammation as well. And it also can happen to men. But it's just that it's not that common in like women that is not breastfeeding, and also in men. Because mainly when we breastfeed, right? Because our nipple will crack easier. So it will, infection bacteria will go in from baby's mouth, or the environment. That's why it's more common in mothers who is breastfeeding.
Okay. But you mentioned earlier, even if you wear a bra that doesn't fit properly, you can cause this as well.
Yeah, it does cause as well. And sometimes the cause is not, it just comes. We don't know the cause. Yeah. Okay. So, but it's just that mainly mastitis is caused by blocked milk duct.
Okay.
Yeah. Okay. So how to prevent mastitis? One, avoid cracks on the nipples. So remember, moisturize like our face, moisturize the nipple, okay, to prevent cracks with nipple cream, okay. And then another thing is fully drain milk from breast, because stagnant breast will actually, which is not empty, right? It can actually be a breeding ground for the bacteria.
Okay.
Because they have food there. Yeah. And also choosing bra that is not too tight or restrictive, especially breastfeeding mothers, cause the consistent pressure on the breast from ill-fitting bras can also block the milk flow, and then the milk ducts will get like clogged. Okay?
Yes.
So another thing is, if you see that your breast suddenly is red and swollen, seek help immediately. Go to a doctor.
Okay. Got it. I think we have a question here from Izati, who's asking how to choose the right bra, especially for breastfeeding mommies. Because she says she doesn't want to sag, but she's a breastfeeding mommy. I think earlier you did mention that breastfeeding doesn't cause sagging.
Yeah, breastfeeding doesn't cause sagging. What causes sagging is actually the the weight that we put on during pregnancy as well, and then our breast will actually engorge as well. So all these are what causes breast to sag. And then choosing the right bra is, first, you have to be comfortable in it. Cannot be too loose, especially when you move around, you don't feel your breast is like hanging around. There is no support. Yeah. So it's actually best to go to those lingerie shop, and get yourself measured. Yeah, that is the best way to get the good fitting bra.
I think a lot of breastfeeding mommies are also very worried about, okay, if the bra is too tight, will it restrict milk and stuff like that?
Yes.
So there's so many issues that they are worried about for their baby's benefit, of course. So I think it's a bit difficult, and you're also a bit reserved in terms of looking for a bra that actually fits you better, kan?
Yeah. I think most women in like Asian countries, right, we usually wear the wrong bra.
Yeah.
Mm.
It's actually a proven fact. We kind of wear the wrong bra size because we're too afraid to get help. We're too shy to get help.
Yes, so we must break out of it. Okay, make sure you go like to get measured. There are professionals. Usually, there is a professional there that help you measure.
Correct.
A good
Yes.
fitting bra. Yeah. Okay. So
All right.
next, we will move on to breast hyperplasia. So breast hyperplasia is actually accumulation of abnormal cells, the milk ducts and also lobules. Usually, it's either one, either the milk duct or the lobules of the breast.
Okay.
Okay, so it doesn't usually cause any kind of symptoms and the causes are actually unknown. Okay, however, the changes can be seen in mammograms. And usually when doctors diagnose through mammograms, they will actually do a diagnosis through biopsy as well to see whether it's cancerous or not. But usually it's not cancerous. Breast hyperplasia is not the stage of cancerous yet. Okay. So, however, the cause of, like I mentioned earlier, is unknown. It is believed to be a natural part, actually, for breast, natural part of changes of some women as we grow older. And it happens in, women above 35 years of age. But it still can happen if you are below 35.
Okay. So how do we know that we have it? I mean, what are the signs to look at?
One of it is always have breast self-examination. Because mammogram, we actually, doctor actually advise only 40, when you have like 40 years above, only you will go to mammogram yearly or once 2 years. Yeah. So for those under 40 years of age, actually by age 20 and above, right, we have to check our breast regularly, our self-examination. Yeah. So, and with breast hyperplasia, it also increase the risk of developing breast cancer.
Okay.
Yeah. So it's very important for us to do self-examination to diagnose it early. Yep.
Indeed.
Okay. So we'll move on to breast health. So one of it, most important, correct posture. Because you might think, why correct posture? Okay, so it actually can help us to prevent our ligament, the copper ligament, from being stressed and strained. Yeah.
Okay.
So correct posture is very important, and then also massage can actually help blood circulation around our breast area, and especially for breastfeeding mummies, it helps to prevent mastitis as well. Okay, and suitable bra, as we mentioned earlier, no ill-fitting bra, no bra that is too loose, it will just cause saggy of your breast. And also balanced diet is not only for our breast health, it's for our overall health. Make sure, and also exercise. So you see earlier on, like our breasts don't have muscle, why want to exercise? so, so exercise can actually not prevent, like, it cannot firm out our breast, but what it does, it actually helps to correct our posture, support our posture, and also it helps to improve our chest, the look appearance of our chest. Yeah. Okay. So yeah, it might look less saggy. Okay. So most importantly is regular self-examination. Okay, this is very, very important. If we have not started doing that, we should start doing that
now.
Now. Okay, so now I'll teach you how to do it. Okay, so for breast self-examination, so it should be done once every month. It should be done 2 to 3 days after your menstruation. So now time to put on your calendar, then to check your breast. Okay, so as early as 20 years old, we should start doing this already. Okay, so we should do it in front of the mirror. So we start with standing in front of the mirror. So we check visually first. So we inspect that if there's any dimpling. So I'll show you a picture of a dimpling. So if you can see in this picture here, right, the arrow here is actually a dimpling. Yeah, so this might is a sign of having a lump in your breast. Okay.
Oh,
Yeah, so you must check for any changes in size, shape, the symmetry of both breasts, and also the color. Okay. And also another thing to check is if the nipple is inverted. Okay. So this is also a sign of, breast cancer. Because
okay.
if you see any of these signs, please go to the doctor immediately.
Okay.
Okay. So after in a visual inspection, so another thing is we have to examine both our breast and also our armpit. Don't forget our armpit, because our armpit area around here does contain a little of our breast tissue.
Okay.
Okay. So we will use our fingertips to check. So we'll check. You can do it in front of the mirror, or you can do it while you are doing while you're showering. Okay.
Yeah.
Use either oil or shower gel to make sure smooth movement. So you must put your hand behind your head like this, because you have to assess the armpit as well.
Okay.
Okay. So you just go around, make sure you check the whole breast, your armpit, and go to the other side. So why is it so important for self-examination is one, even like we have no symptom, right? So it's important is because we have to know our normal breast. Because if we don't know our normal breast, when something abnormal happen, we wouldn't know as well.
Very true.
Yeah, that's why it's important. We have to start immediately already. Don't wait anymore.
So if you actually have a larger breast, then will this same method apply, or is there a different method?
No, the same method will apply for all sizes. Yeah.
Okay.
Okay. So next, the current postpartum breast care we have in the market is actually massage. We all know massage is something very we are all familiar with. And another thing is known as Indiba treatment. Might be new to some of you. Okay, so I'll talk a little about how Indiba help in breast care. Okay, so with Indiba, it actually helps to promote collagen and elastin, which help to lift and firm up our breasts.
Okay.
So another thing is it helps with blood and lymphatic circulation. Help with sometimes after pregnancy we'll have swelling, right? Because of poor circulation, lymphatic circulation. So it helps with that. And then it helps to reduce pigmentation. So it can actually help to lighten our nipple and areola, but it only helps to return to original color, yeah? Nothing more than that. Okay. And then also it helps to soften breast nodules. Because breast nodules very important to soften it, because hard nodules can actually reduce the lymphatic drainage and also cause swelling.
Yeah. Okay. It'd be blocked, isn't it?
Yeah. So next is the reduced axillary breast.
What is an axillary breast?
So axillary breast is actually just the extra fat that we have right in front of our armpit.
Okay.
Yeah, so it's most obvious if we wear a bra. Sometimes you'll see like Y2 fat sticking out here. Yeah, so that is the axillary fat. And also it can help to reduce underarm swelling.
Okay.
So how Indiba helps in all this is because of the core technology with 448 kilohertz proionic system. So Indiba is actually a radio frequency. So, and then with generation of heat from within, this will actually help to improve our breast overall health by promoting healthy cells function and also improve the blood flow to our breast. Okay, so next, those pictures are coming up, pre and post pictures we'll share with you. Okay, so these actually pictures that with our clients that have done Indiba, we just like to show you. So the picture on the left is actually the before, and the picture on the right is the after. Okay, so you can see this one is with 3 sessions of 30 minutes. The breast, you compare to both sides, you can see the nipple is actually higher here. So it's already firm up, less saggy. Okay. So next picture is also breast care. You can see both sides, it is more equal in size now. Okay. Yeah. And this one is, it shows the lifting and firming effect before and after. Okay. And this one is also, you can see it firms up and also is more lifted. The size are also more equal after. And last one is the axillary breast reduction. So this is the armpit, yeah. So with 2 sessions actually help to reduce the fat quite significantly.
Interesting.
Yeah, so that's all for my presentation today. That was
Can I ask though? I mean, is the Indiba treatments actually effective for any kind of breast? I mean, is it only like, if it's not big, or it's supposed to be the normal regular size breast, or any size doesn't matter?
Yeah, any size, any shape doesn't matter, because what it targets is actually our cell.
Okay.
Yeah, our normal functioning cells. Yeah, so any kind of problems, most of the problems it can be.
And how long does it take though?
Each session is about 30 minutes.
No, I mean, how many sessions? Sorry.
How many sessions? Usually we'll start with a more frequent session, probably like 2 to 3 sessions in a week. And then as we improve, then we will slowly space out the sessions. Yeah, so it's depending on your condition as well.
Okay. All right. Cool. All right. So, ladies, we have altered the program a little bit so that we are giving you an opportunity to ask all your questions right now. We're gonna run the Q&A session with Ising, because I think the ladies have loads of questions to ask. So, let's take a look at question 1. Saya dah bersalin 4 months sekarang. Masalah saya tak banyak susu. How?
Okay, so production of milk is actually based on our body.
Okay.
So sometimes the food that we take might also cause the production of milk. Yeah.
Okay.
So actually, usually our breast is will prepare the right amount of milk for the baby.
Okay.
Yeah, because this is like it's a natural phenomenon. But if you feel like your breast milk is not much, then probably you can look for like a kind of different kind of diet or some supplement to help to boost up the milk production.
I think there are milk-inducing foods, kan? Like oats and stuff like that.
Yeah, so there are like lactation cookies as well. Something that you can look into. Yep.
Yeah. Okay. Question number 2: can massage help to lessen the saggy breasts?
It does not so much. It mainly helps because, as you know, the sagging, like I mentioned earlier, it's because of the what do we call the ligaments.
Correct.
So it does help slightly, but not major changes. Yeah. So mainly massage is just to help, especially postpartum, is just to mainly help to what we call for the breast milk flow.
Okay. Yeah. Okay, I think 3, 4, and 5 is kind of like related because we've covered this earlier. But question 3 is breastfeeding does not cause sagging. Really, true or false? I think when we breastfeed, our breast will expand when the milk is full also, and slimming down can cause sagginess.
Yes. Okay, so breastfeeding, yes, it is not the main, it does not cause sagging, like we mentioned earlier, because of we know sagginess is actually mainly from the ligaments, and then it's the changes of size that is causing breast sagginess. Yeah. When the milk is full, it does expand, but not to the extent to cause so much of sagginess. Yeah. So it's actually the changes of size, not breastfeeding. Okay. Slim down, yes, because slim down, we cut down the fat. Yeah. So the fat from our breast will also be cut down. So yeah. It will cause sagginess.
I actually never thought about that though, because I always thought that if you slim down, then the size of your breast will also reduce, right? But it wouldn't necessarily cause a sag.
Yeah, it's just that if you gain weight too much of weight, and then your breast size increase a lot, then it will cause major sagginess. Because if just a little, usually not so much.
Not so much. Okay. All right. Question number 6. Bengkak susu also can cause cancer?
Bengkak mastitis? No, mastitis does not cause cancer.
Okay. Question 7. I really want to know how to improve sagging breasts.
One of the treatment, as you mentioned earlier, you probably can try Indiba. You can approach Is'Belle to talk to them about the treatments that they have to help you with sagging breasts.
Okay. Number 8, I don't like to wear a bra at night. Is it okay? Okay, I want to say something about this question though. A lot of people have always said if you don't wear a bra at night, it's good. But then there's also the other side of people who says if you don't wear a bra at night, you will cause sagginess. So what is the truth behind that, I think?
Okay, so without wearing you don't wear a bra to sleep, cause sagginess is actually a myth.
Okay.
Because when we sleep, we are lying down, right? So
Okay.
there's no gravity pull, nothing. So it won't cause any sagginess unless we tend to sleep on our abdomen.
On the abdomen. Okay.
Yeah, because it will actually put pressure on our breast as well.
Okay.
Yeah. So
And
yeah,
is
it's
it
okay
okay?
to not.
Yeah.
Yes.
Oh, okay, cool. Number 9, why some people right after deliver can produce milk, but some takes 2 or 3 days. Also, in her case, she needs to do a massage to stimulate the production of milk.
Massage is actually help the milk to flow out more smoothly. So you might feel that when you massage or the production of milk is more smooth, is more. Yeah, that's the case. Yeah.
Okay.
So everyone's body is different. So the hormonal changes, as we mentioned earlier, estrogen and progesterone is the one that actually help to stimulate milk production. Yeah. So
Okay.
it depends on individuals, the production of milk.
Okay. Question number 10. Do we wear a bra with or without a wire? Which is better?
Okay, so this actually, if you are breastfeeding, we would encourage to wear without a wire because the wire might put pressure onto your breast and then cause the milk duct to clog.
Yeah.
So, but then if like normal, it's okay with or without a wire as long as it supports your bra. Your breast, not your bra. Yeah.
Okay. I see a question that just came in actually. The question comes from Hamida. She's asking, does the way we breastfeed also be a reason for sagging breasts?
No.
Okay.
Yeah, you can breast as long as you're comfortable. No, it actually doesn't cause any sagginess. The position of your breastfeeding. Yeah.
Okay. All right. So I think that's all the questions that we have on our Q&A segment. I wanted to ask you, I think just now, what are the signs of hyperplasia?
What are the signs of hyperplasia? So actually, there is no sign. Usually, there is no sign. Yeah. But then.
So how would we know?
So actually, a lot of people go without knowing this. And usually when hyperplasia happens, right, it will actually go back to normal as well. So in most cases, it will just return to normal.
Okay.
Yeah. So, but then of course, if hyperplasia it turns cancerous, that is when you start feeling there is a lump in your breast. Yeah. So if let's say you have a family history of breast cancer, it depending on, like, for example, someone's mom has breast cancer.
Yeah.
At the age of 35. So, because as I said earlier, right, a mammogram we go to check, like when it's advised to do it when we are 40 and above. But then if you have a family history of breast cancer, and like let's say her mom starts to have it was diagnosed with breast cancer at 35 years of age, you can actually start going for mammograms at the age of 30. Yeah, 5 years earlier than the age. Yeah.
Correct. Okay, and my last question before I let you go is, if you go on YouTube or you go online, right, they will tell you, okay, here are some exercises that can help you make your breast perky, right, reduce sagginess, help elevate your breast and stuff like that. Does it work?
No. So because our breasts don't have any muscles at all.
Okay.
The muscle is actually on our chest underneath the breast. So by exercising, you might just improve the appearance of your chest, but not your breast. It won't affect your breast.
Okay.
Yeah.
All right, cool. So ladies, if you don't have any more questions, thank you so much, I think, for that very insightful session. I think today we learned a lot about our breasts, and we also got homework later to go and check how, if our breasts are still perky, or if it's a little saggy, we need to go and check that. So we all got homework this evening. We all learned a little bit more than we did before this session. So thank you once again, Ising, for this very
Thank you,
insightful
Meg.
session.
Thank you for having me.
All right, it's time for me to call on Miss Chia Li Ping. She's the managing director of Is'Belle. Is'Belle is currently they host a whole lot of beauty treatments, including breast treatments as well, and they are always looking out for better ways to help us look good and feel better. So let's bring on Miss Chia Li Ping.
Hi. Thanks for having me here.
Hi, Li Ping. How are you today?
Very good, very good. Mine was quite bad because it's raining over here.
Oh dear, I hope you caught at least parts of the whole session just now.
Yes, I did.
Fantastic. So you own Is'Belle. Tell us a little bit more about it.
We have been operating Is'Belle in Subang Parade for 18 years.
Okay.
We started off with facials and body treatments. Then later on, we move on. We find that there's a niche market for breasts. So we start to go out to explore more machines, treatments for breasts. Until we found Indiba. Indiba have a very unique technology which utilize 448 Hertz that targets on cell proliferation. So with these treatments, it helps you to firm up and smoothen the skin or smoothen the breast with minimum time, minimum effort. It delivers results very fast. As you can see from the slide, with one treatment, you can see results.
Yeah, that's fantastic, isn't it? I just want to know, I'm curious, how did you find out about Indiba?
Oh, then they have a very good sales team. They have a very good sales team that, and also I would say that the technology, I went to a beauty fair, then I study the products and then try the treatment, and it really works. When I tried the treatment, I tried a number of machines, which what impressed me is that this treatment with 30 minutes, it gives you result quite instantly. And in fact, after the treatment, I didn't inform my husband about it.
Okay.
After that night itself, he noticed the differences.
That's a tricky situation for husbands, okay? That's like, I want to see whether he noticed the changes. You put your husband to test. I mean, you've been doing this for so many years. Do you have a story of maybe someone who you saw rapid changes and it actually helped to improve the quality of their lives as well?
I have a customer who is 60 over years old, with saggy breast.
Okay.
She concerned about her condition. That was a number of years ago. Then she come religiously for the treatment. Because due to MCO, she stopped coming. Because we cannot operate, because beauty salon have to stop operating for a number of months. Then after MCO, when she comes back, she shows us her breast still in good condition. Without treatment for 2 years.
Wow, that's brilliant.
Yes, in the part treatment, it really have a lasting effect. Not to say that when you stop going for this treatment, the result isn't there. It grows within you.
Okay.
So the result is very good. It's very lasting.
So how many treatments do you need to go to see your version of, qualified or the right perkiness that you wanted to see, kind of thing?
Depending on individual expectation, we can even deliver result in one treatment.
Oh, wow. Okay.
Yes. Yeah. We did one recently with Tatin Suri. You can ask her about it.
Fantastic. So, when you do these treatments, is it a lifelong thing? Is it a lifelong commitment, or you will eventually stop going for treatment because you're happy with how you look already?
Actually, breast treatment is just like exercise.
Okay.
What you want to achieve. what you're going to achieve. You cannot expect exercise to last forever.
Okay.
Yeah. After a certain period of time, you need to exercise back.
Again, yes, correct.
So it's all depending on your expectation. So of course, if you can come regularly for the treatment, the result will be more lasting. As I said, my customer stopped coming for 2 years. The result is still there, and she's very satisfied with the result. Yes, yes.
Brilliant. Okay, I see a question from Jessie. She says, what is the treatment about? Maybe you can explain how the treatment is done so that, our viewers can get a clearer picture or imagine how it's done and how they see the impact as well.
We start off with cleaning of the breast. After cleaning off, we do a scrub. It's just like a facial. We scrub the breast. After scrubbing the breast, then we'll examine the condition of the breast. Then we will do a consultation to tell the customer what they're going to expect. Maybe the breast is left or right, east or west, then one big, one small, or what you want to achieve. Because customers' expectation also we want to know what they want to achieve. Then after that, we will do the treatment. This Indiba treatment is about 30 minutes. After the Indiba treatment, then we'll go for a massage.
Okay.
After massage, as a mask. That means it's like a full facial treatment, a full breast treatment. So the whole session takes about 2 hours.
Okay. So there's no there's no like surgery or anything, right? And you can probably do it like during lunchtime. Is there any pain?
No, no pain, no pain. You go out with confidence.
Okay. So your 1 hour lunchtime, 30 minutes, you go do breast treatment. Okay, one.
Uplifting treatment.
Uplifting treatment. I like that. Okay. So this evening, we also have our guest. She is a Mama Net ambassador, and she's also a very, very established entrepreneur. She's done many great things already. I read her whole profile. It's amazing. Okay, so we're gonna bring on Datin Sri Annie Lau, who is our special guest. She's actually won quite a lot of awards and have gained a Women Achievement from Malaysia Book of Records Business Edition as well. And she's the ambassador and founder of the founder and CEO of Bailayu Spa Sanctuary. Hey, Datin Sri, how are you today? Datin Sri Annie, you are muted. Hi,
Hello,
how are you?
Hello, everyone.
Welcome to the show. How are you today?
Thank you, Mama Net, for having me today. Good to see all of you.
So today you're going to share with us your experience doing this breast treatment. How was it like?
Yeah, I think this is the first time I do this kind of treatment because to be very frank, most of the women, right, we only take care of their face, okay, by doing facial maybe every week or every month, okay. But for me, I never do this kind of treatment, so this is my first time to try really professional breast treatment. I can say I really enjoy during this treatment. I think around 1 hour, 1 hour.
Okay.
Very relaxing. I even sleep. No pain at all.
Okay.
Important, the effectiveness is very, very powerful because when I wake up after 1 hour, I can see longgang. I can see longgang. So it's really firm up, firm up my breast. I can feel it immediately.
Okay.
So I said, wow, this treatment very relaxing and very effective. And I said, I really like this treatment. Then I actually asked the therapist how often I can do this treatment because it's very good. Because I feel this treatment is more like a healthy treatment.
Okay.
Because the way they do, right, they will do scrub and then do the machine. After that, they use the hand to massage as well. So I can feel it's like a very blood circulation for my breast, I think it's very good for healthy breast treatment. So I actually encourage more people, especially women, we have to do this
often.
Often, yeah.
like you said, many of us actually worry about our face, right? But we actually need to do treatment for other parts of our bodies too. And our breast is definitely one of the most important assets that we have, isn't it?
Yeah. Especially like I just give birth because my baby girl is just 11 months.
Oh,
So
congratulations.
Actually, our breast really, I can say, because breastfeed for 4 months, right? Our breast is really sagging, So sometimes women, we wear bra, right? We maybe just cover it. We don't like feel it.
Yeah.
But when the therapist today they tell me it's like different size already.
Yeah.
Then I said sometimes we don't see ourselves, but I know it's sagging already after breastfeed, especially. So I didn't know that actually such a healthy treatment they have in Is'Belle. So I actually very thanks Mama Net and especially Jillian in introducing me to this Is'Belle. Thanks Miss Chia also.
Thank you, Julian. Thank you.
Yeah, their team, I can say, really professional, very experienced, because they did this beauty salon already like 18 years. 18 years. All their therapists are very, very experienced. I can say very experienced. I really love it.
Fantastic. Okay. So our viewers this evening are very curious about this treatment. And let me tell you, ladies, that our lucky draw prize is that treatment. Okay. So we're giving out 3 sets of this amazing Indiba treatment for you to experience it yourself, or just in case you forgot how to take part in the lucky draw. Let me just remind you, number 1, you got to download the MamaNet app. Number 2, you've got to fill in your details and fill in all the questionnaires. And finally is to paste in the special referral code that you saw at the end of the video earlier. Now, if you are posting your codes in the chat box, you don't qualify that way. Okay. So when you submit that thing in your MamaNet app, right, then only you qualify for the lucky draw. And of course, you got to remember your ID, because that's what we're going to be calling out at the end of the night. Okay, so it's worth 2,400 ringgit. It comes in 3 sessions. You're going to enjoy it. And like, Datin Sri said, you can see it and you can feel it immediately. It's like one of the best things that have ever happened for our breasts. Finally, there's something for our breasts, you know what I mean? So I'm just curious though, Li Peng, is this safe for breastfeeding mummies, or do you have to wait after you've done with your breastfeeding?
You can do during breastfeeding.
Okay.
No issue.
Okay, no problems, huh?
No problem.
No problem. Fantastic. Datin Sri, I want to know, did you test your significant other as well and say whether he noticed any changes like Li Peng did?
Not yet, actually. Because actually the therapist told me, actually the first treatment, right, you can see immediately firm, but after few more days, you're even firm
Oh, fantastic.
That's why they said actually if we can like continue do it like every week, even the result even better. Yeah.
All right. Fantastic. I love that. And I think a lot of our viewers are very excited. So Izzati Fatima has a question. If you are old, can you do this treatment like 50 plus? Just curious. I think you can, because Li Peng mentioned just now that her customer was 60 years old, right?
Yes. Yeah. There's no age limit.
Okay. So are there like any requirements or anybody who cannot actually try this treatment?
No,
everybody can.
Yeah. Everybody can, but on the other hand, those with pacemaker.
Okay.
Not
so
allowed.
Pacemaker cannot lah. Okay, fantastic. All right. Are there any side effects though? I'm sure everybody's wondering if there are.
No, none.
No side effects.
Very safe treatment.
Fantastic. Effective without side effects. What else can we ask for, right?
Yes,
so,
right.
Ladies, if you have any more questions, please type it in the chat box below.